Yeah, hello. I'm glad to be in this meeting. I'm Dr. Rizvan Ahmed. I'm a consultant physician at Continental Hospital. Today I'm going to speak about hypertension, which is a very common problem. I would like to, this meeting is especially for the awareness and the general public about the hypertension. Many people, though they know about the hypertension, but they ignore it. They think it's a simple thing. So most of the people, they know about the hypertension. Hypertension means a high blood pressure. So as we age, so our arteries, they become stiff and stiffer. So it's natural that most of the people in this generation, usually they develop hypertension above the age of 40 years or 45 years. So normal blood pressure, it's about 140 and 90, 140 over 90. That is the maximum it can be, and above that it's supposed to be, it's called as hypertension. And any values below 140/90, it's called as normal blood pressure up to a level of like 100/70, like that. So any blood pressure in this range can be a normal blood pressure. So there is a stage called pre-hypertension. So before the onset of the hypertension, the blood pressure may range between 120 to 140 systolic, and the diastolic may be range from 80 to 90. So this the blood pressure it's called as pre-hypertension stage, which occurs before the onset of the true hypertension. So it's available that once in 6 months or so, or at least once a year. And if the blood pressure is abnormal, or if you're in the pre-hyper, so what happens? Why the blood? Why are we worried about blood pressure? What happens? So you can in your house, for example, the water is running in the pipelines. So suppose if it runs in very high pressure, what happens? So in very high pressure, there can be leakage from any point. So similar thing happens when we are in high, when the blood pressure is high, because the blood is circulating under high pressure, so it can leak from anywhere. There can be bleeding from anywhere. Since the blood vessels are supplying blood to all the organs, so human body is nothing but a collection of organs. We have the brain, the heart, the lungs, the kidneys, and liver. That is what the human body is, isn't it? So since the blood is circulating under high pressure, so all the organs in the body are getting the blood in a high pressure. So what happens is, over a period of time, because of the high blood pressure, the arteries and the blood vessels become stiff and thick, and they tend to become narrow. And then there is tendency of damage to these organs because they are working under high pressure. So what are the important organs of the body? For example, the brain. The brain, under high blood pressure, there can be bleeding into the brain. There can be stroke. Or the high pressure can affect the eyes. For example, there are changes which can cause bleeding into the eyes. High blood pressure affects the heart. So the blood pressure causes damage to the heart. Because it has to pump under high pressure, it itself becomes stiff and thick. And then there can be clots in the heart blood vessels, which leads to heart attacks. So and high blood pressure, the blood is flowing under high pressure into the kidneys, so it causes damage to the kidneys, leading to high creatinine and kidney failure later on over a period of years. So all the organs of the body are affected because of the high blood pressure. So what causes the high blood pressure? Earlier, like we still see the old generations, like the people, they come to us in the ages of 60s or 70s. These are the older generations. So till now, still they don't have high blood pressure. So these are the old generation, but now the new generations, because of their sedentary lifestyle, being overweight, smoking, and fast foods and all that. So they become hypertensive. They are becoming hypertensive. I have seen people even at the age of 25 years or 30 years who are obese and sedentary lifestyle. They come with high blood pressure. So it's a norm. It's a become a normal phenomenon now. So what are the conditions which leads to high blood pressure at a younger age? So it's our lifestyle, the sedentary lifestyle, uh, being overweight, smoking, and stress. And for example, it can be genetic also. For example, both our parents are hypertensive. It's more likely that you also turn to be hypertensive later on. And then some female patients, they are pregnant. They are, during pregnancy, they have high blood pressure, and they continue to have high blood pressure later on. So that's what happens. So most of the blood pressure is called as essential hypertension. It is without any reason, without except these factors, the stress and the overweight. Otherwise, only 10% of the cases has a really some other cause of high blood pressure. For example, this is called as secondary hypertension. So these 10% of the patients may have something like, they may have some kidney problem, they may have some hormonal problem, they may have some disease called as obstructive sleep apnea. Those who do a lot of snoring while sleeping, so they have disturbed sleep, they don't sleep at night. So this leads to hypertension later. So this is called as secondary hypertension. But only 10% of the patients who have hypertension have this secondary hypertension. Most of the patients who have high blood pressure, 90% of them, they don't have any such reason. So should we treat the blood pressure or not? That's our question. Many patients they don't like to be started on antihypertensive drugs because they think that once we start on treatment, it has to be lifelong. So they deny, first of all, it's just a phase of denial that they don't have blood pressure. It's a false sense of security. No, I don't suffer from high blood pressure. They tend to deny it. So it goes on for months, for years, and then ultimately they come with some complication or with very high blood pressure and with some organ damage they may come. Um, um, so just don't, I advise the people that when it is very clear that you have high blood pressure, don't deny it. So it's almost normal nowadays to be above the age of 40, above the age of 35 to have high blood pressure with this our lifestyle. So it's not necessary that we start the treatment immediately. Suppose if the blood pressure is just above 140 over 90, and then we can wait. We can wait for a period of a month or 2 months or 3 months and have multiple recordings of blood pressure at different times. If the blood pressure is continuously high, then at that time we can start the medications. So some people, or I'd say most of the people, are bothered about the number of pills, how many pills we should take. So they count the pills. So some patients, they need 2 or 3 types of drugs to control their hypertension. Some of them they well control just only with one drug. So don't count the pills, because the doctor's target is not the number of pills, to reduce the number of pills. Our target is to reduce the blood pressure. We don't want our organ systems to work under high pressure at any cost. It may be controlled by 1 pill, 2 pill, or 3 pill, whatever. So whatever the medications which are used for the blood pressure, our target is to bring the blood pressure. So, besides that, we advise the patients initially if the blood pressure is just borderline, lifestyle modification important. It plays a big role. Lifestyle modification is sense of relaxes your blood vessels also dilate, that brings down the blood pressure. A good sleep, 8 hours sleep, it's necessary, will shoot up. And also we advise the patients to lose weight. Those who are overweight, they definitely go on to develop hypertension. Suppose if you lose, for example, anybody who loses 10 kg of weight, for example, anyone is like 90 kg, and if he loses 10 kg of weight, 80 kg, he becomes, then his blood pressure will reduce by 10 millimeter of mercury. Suppose he's 90 kg and his blood pressure is 150. So if he loses weight, just lose weight, no other treatment, just lose weight from 90 kg to 80 kg, his blood pressure would come down from 150 to 140. Right? So that's it. So lifestyle modification is very important. And besides that, in the diet, what we advise is just low salt diet. There is no other diet restriction. Like in diabetes, not a lot of diet restrictions except that for low salt diet. So some people they get confused that okay, I take low salt diet, but still my blood pressure is high. But unknowingly they take high salt. Some patients, they say that they take low salt diet, but they eat pickles, they eat peppers, they eat chutneys, they have ketchup, so these are the foods which are very high in salt. The pickles, the peppers, the chutneys, and the uh, in the Indian food, and all the bakery products like salted biscuits. You can take like bread which is made in the bakery. It contains salt. And then not only that, in the bakery products they put sodium bicarbonate, soda, what you call it, the baking soda. So baking soda is nothing but sodium bicarbonate. It contains sodium, so we don't want sodium. So because sodium retains water, and then it can cause high blood pressure. So the low salt intake is very important. It's not advisable to completely cut down the salt, but it is advisable to um, cut down their food, which is very high in salt. So the number of the drugs. Control the blood pressure. As I told, it may be one drug or two drugs or three drugs may be required. So between 140/90 to 160 or 100, it's called at stage 1, and above 160/100, it's called at stage 2 or less hypertension. If the blood pressure is in stage 2 or stage 3, then these patients definitely they need to get pills. Don't count the number of pills or the strength of the drugs. So our target is not the number of pills or the strength of the drugs. Our target is to maintain a normal position, to bring the blood pressure to a target of below 140/90. So there are a number of drugs which are used for the hypertension. I will not go into the details of that. Depending on your associated disease. For example, if any patient is diabetic, so some drugs like APS or ACE inhibitors are preferable for them. So the doctor would select the kind of drug depending on your situation. And last but not the least, it's important to cut down the smoke, because the smoking, it contains nicotine. So nicotine will cause a sudden rise in blood pressure, a shoot in blood pressure. So all your drugs, whatever taking, would become ineffective. So I hope I have given you enough information, and I have cleared many myths. I hope my information would be useful for you. If anytime you have any doubt, anything, you are welcome to Continental Hospital. Okay, thank you very much. Have a good day.